the symptoms they report can be essentially identical. Someone who has acute stress reaction and eventually goes on to develop post-traumatic stress disorder, and someone who has a blast concussion. Both of their head CTs are negative, both of their clinical MRIs are negative, but I believe our test will be able to discriminate between them. Traumatic brain injury is a large category that encompasses any time that there's a force to the head that causes an deceleration of the brain inside of the skull. And so that can either be if the head hits something, but it can also occur if there's a blast overpressure wave that passes through the body that hits a person, causing an deceleration of the tissue of the brain itself. Everything is intact, but the force of that pressure wave going through the whole brain caused something called diffuse axonal injury, where the axons have been sheared. And that's essentially the definition of a traumatic brain injury. The biggest advantages of a blood test are that, one, it's super fast. It's generally less expensive than other types of biomarker tests. And so these two proteins, glial fibrillary acidic protein is a glial marker. Glia are sort of the support cells of the neurons in the brain, and UCHL1, which is a marker of neuronal injury. And what's really interesting about these two is that when you have a concussion or a more severe traumatic brain injury, then you have almost immediate elevation in the blood of UCHL1. And so with these two markers, if you measure both of them together, you have an opportunity to identify someone who's had a brain injury, not just in the first hour or in the 24th hour, but across the whole entire day. And so that's the power of putting these two together in a single blood test. So there's a huge amount of potential for expanding the scope, the context of use of this test, not only for saying who needs a head CT and who doesn't, but also for helping us to really identify those patients who maybe had a negative head CT who actually really did have a brain injury. Where my research comes in is what I sometimes like to call the valley of death. So you have 20 years of research that worked on developing this blood test, but very few hospitals are using it. Having something that we know works and then getting it to the point where it's actually used to help patients in the real world. This area of research is called implementation science. One of the final, most important, I think, challenges here up until today without this blood test is that soldiers who come in after these battlefield injuries with acute stress reaction from psychological trauma can look virtually identical to someone who had a blast concussion. And they can report that they were stunned, they were confused, they don't really remember it so well. And that's so important because what actually happened inside of the brain of those two soldiers is completely different. And so this test to me is extremely exciting because we can better evaluate, better diagnose, better understand those brain injuries that have absolutely nothing on head imaging. I just feel incredibly grateful to have the opportunity to apply this knowledge and the skills that I have to help our country here in Israel.